Hello everyone, here we are again with Cancer Prevention 14, and we are gonna finish the other cancers. In this session is the last session that we are gonna talk specifically about types of cancers. So we did the first session of that in Cancer 13, and we talk about different cancers that are not that common, and we will finish now. Starting with stomach cancer. Stomach cancer is kind of frequent. It's the 50th most common cancer in the world. More common in men. Generally fatal when discovered because it's not easy, or the symptoms of this cancer is common, like nausea, vomit, and heartburn, and things like that. And is not a cause of diagnosis that is frequent. Is the third cause of cancer death in the world. So in terms of cancer death is very aggressive. I would not say aggressive, but because the diagnosis is not made that early. 952,000 cases were happening in 2008. And is more frequent among adults. In the United States, the diagnosis most common is among 72 years old. The 5-year survival, as I mentioned, is 25 to 28%. But again, if the diagnosis is made earlier, it's going to be 60% survival, so it's much better. There is other environmental factors that are related to that: wood processing, machine operators, rubber manufacturing, coal mining, chromium production, metal processing. So it looks like those air pollution, environmental, would increase the risk of cancer. Somehow this air will affect the stomach. We don't know well if this is by inhalation and then going to the circulation of the stomach, or is because when you inhale, you also absorb those substances in the saliva that are in the environment, and then you swallow that to the stomach. Stomach cancer is very particular to me because it changed my life. Not because I had stomach cancer and not because any of my family relatives had it. But I was in medical school and I was prepared to be a surgeon. And then I was thinking I'm going to prepare myself. So I started internship in the medical center in South Brazil. And then after one surgery that I went, I stayed 6 hours on that surgery. And then when I was during the surgery, they opened up the stomach, and then they figured out that there was a stomach cancer, and it spread to the whole peritoneum, and it spread to the liver, to the intestine. It was a terminal cancer. They just opened the stomach, they opened the cavity, saw the stomach, opened the stomach, closed the cavity, nothing to do. And then I was thinking, should I stay the whole life spending my life to do such kind of operation? Maybe I should spend more time trying to prevent this situation, trying to help people to change their lifestyle or whatever it is that caused this kind of cancer, instead of doing nothing when it's too late. And then on that time, at least when I was in medical school, I decided, okay, no more surgeries. I will dedicate more for prevention. Because there was no many people that were dedicating the life to to be preventionists, as I call today. Most of people went to surgeries and treatments, but nobody was going to the specifics of what is that is causing the disease and to help to prevent those to happen. Stomach cancer is related to alcohol, and 3 or more alcohol drinks per day increase the risk of cancer. No doubts about that. Also is related to processed meats, ham, bacon, pastrami, salami, hot dogs, and sausages. And is related to overweight and obese. The cancer is related to a bacteria called Helicobacter pylori, or pylori, someone might say. There is a suspicion that another virus called EB virus or Epstein-Barr virus is suspicion. Epstein-Barr virus is related somehow to esophagus cancer, as we will see in the next chapter, or in the next cancer that we are going to talk. Also, smoked, dried, salted, and pickled foods will contain nitrates, and they are very common to produce stomach cancer as a cause of stomach cancer, especially in Southeast Asia. I used to live in Hong Kong, and this is the kind of food that they like, especially smoked fish that are very rich in nitrates and nitrosamines. And those nitrosamines and nitrates will increase the risk of stomach cancer and esophagus cancer and nasopharynx cancers in this area. Pickled vegetables also are related to this type of cancer. There are 2 types of stomach cancer. The upper part of the cancer, that is the cardia, that is more common in developed countries and more related to overweight or a pressure from the stomach up, and then related to things that are more common in the United States and European countries. And then we have the lower stomach or non-cardia that is more common in Asia. It's more common, more related to infection and more related to the H. pylori or H. pylori infection. Non-cardia is decreasing because of refrigeration and less salting. So we know that refrigeration will decrease the presence of H. pylori and then decrease the risk of this cancer. But the cardia, the ones that are more common in the United States and Europe, is increasing in the population. What is that we know is that eating less fresh fruits, there are some evidence that this will increase the risk of the cancer. In any ways, we advise people to eat more fruits because there is a lot of other benefits of eating lots of fruits. Some evidence about less citrus fruit also are related to increased risk. And then there is some evidence that barbecued meats increase the risk. Lack of refrigeration, as I mentioned, because increase the presence of the Helicobacter. Smoking, 11% of people that smoke, I would say 11% of the people that have the cancer are because of smoking. Or a previous stomach surgery, family history of the cancer, the presence of ulcers, or gastritis. Helicobacter pylori, it looks like Helicobacter pylori in a diet that is rich in those processed and salted meats will be a very strong cause of stomach cancer. But Helicobacter pylori can be treated with antibiotics. We also ask the person to check for digestive symptoms, heartburn or pain. If the person has that, or always with a problem with digestion, it's important that this person be checked for the presence of the bacteria. Garlic, broccoli, and selenium-rich foods like mushrooms have anti-Helicobacter pylori properties, so it's good to have this more in your diet. And then here we have the treatment that is approved by the FDA for Helicobacter pylori. I'll read at least the two more common. Omeprazole 40 milligrams plus clarithromycin 500 milligrams. And the omeprazole should be taken 4 times a day, 40 milligrams. Clarithromycin should be used 3 times a day for 2 weeks. And then after that, omeprazole 20 milligrams 4 times a day for 2 weeks. Or ranitidine bismuth citrate, or they call RBC, 400 milligrams twice a day. And then clarithromycin 500 milligrams 3 times a day for 2 weeks. And then again the RBC, ranitidine 400 milligrams twice a day for 2 weeks. If you have these, it's just an illustration of what is advised to treat Helicobacter pylori. And of course, if you are in a place that in the United States, you should consult your physician for that. If you are outside of the United States, again, it's important to have a doctor or at least a nurse that knows about this medication. So what is the advice? Avoid eating too much salt, avoid eating meats, especially preserved, smoked and barbecued meats, avoid pepper, pickles, avoid alcohol, and manage weight. Diets rich in refined grains and refined sweets are related to higher incidence of the 2 cancers, both cardia and non-cardia. Again, there is a relationship between stomach and colon cancer. It looks like diets rich in refined grains and refined sweets are related to higher incidence of these 2 cancers. This was an old study, but was a summary of 15 epidemiological studies by Jacobs in 1995. So we know that there is some protection for stomach cancer. Fruits, refrigeration, use of yellow vegetables, garlic family, legumes, selenium. There is some doubts about that, but there is some evidence. So as I mentioned before, those things are not harming, and so you better use that more if you are at risk. There is one test that is used to check for the presence of Helicobacter pylori that they call the breath test. We are going to watch a video now that is talking about this test. That is a simple test that could be done to check if you have the disease and then to do a treatment for it.
Excellence introduces the Breath ID HP Urea Breath Testing System, advanced non-invasive testing technology for the world's most common bacterial infection, Helicobacter pylori, more commonly known as H. pylori. The Centers of Disease Control and Prevention estimates over 2/3 of the world's population is infected with H. pylori, often unknowingly. The bacteria causes a variety of gastrointestinal issues, including the majority of gastric and duodenal ulcers, and is even linked to gastric cancer in recent studies. The Breath ID HP breath test system is a state-of-the-art, continuous flow, real-time breath testing technology, clinically proven to be 100% sensitive and 99.2% specific in testing for H. pylori, and designed to only take 10 to 15 minutes from start of the test to immediate real-time results. A physician can now, in the very same office visit, obtain highly accurate test results and immediately prescribe treatment if the patient tests positive for H. pylori. The Breath ID HP has also been designed to be CLIA exempt, enabling any physician staff member to administer the simple and intuitive test. And with established urea breath testing CPT codes, the Breath ID HP offers very important opportunities for greater revenue potential, most often with higher reimbursements and revenue than with other non-invasive H. pylori testing methods like blood antibody and stool antigen testing. Here's how the simple Breath ID HP breath test for H. pylori works. First, the test operator gently places the nasal cannula in the patient's nostrils, ensuring the tubing is arranged until it fits comfortably. The patient relaxes and breathes normally. Next, the other end of the tubing is easily connected to the Breath ID HP unit with a simple twist. The operator presses the Start button on the interactive touchscreen and the system begins collecting baseline data of the patient's normal breath. While the baseline is being established, the operator prepares the Breath ID HP test drink by mixing the contents of the test packet with warm water, stirring to ensure the mixture fully dissolves. The mixture of carbon-13 urea is what helps identify the presence of the H. pylori bacteria. Once the baseline of normal breathing has been established, the system instructs the operator it's time for the patient to drink the glass of solution. After the patient finishes drinking, the operator presses the Continue button on the touchscreen, beginning the system's measurement of the metabolization of carbon-13 urea. Progress is shown on screen. If H. pylori bacteria are present in the stomach, the carbon-13 urea is metabolized and appears in the patient's breath. If H. pylori bacteria are not present in the stomach, the carbon-13 urea is naturally eliminated. Measuring continues until sufficient data is collected. When the result of the test is conclusive, the Breath ID HP automatically prints the results, which can be stored in the patient's file, or the test results can be downloaded onto the USB drive key for EMR-compatible data transfer. The Breath ID HP system is recognized by renowned organizations such as the American College of Gastroenterology as the clinically proven non-invasive testing method of choice and recommendation for managing H. pylori. The Breath ID HP tests are highly reimbursable with established CPT codes, meaning greater revenue potential for your practice. It's safe and non-invasive. It's convenient for you, your staff, and your patients. The test is simple, easy to use with one-touch operation with immediate results. The Excelens Breath ID HP breath test system, advanced technology for improving the science of healing and the business of medicine. For more information about the Breath ID HP breath testing system, visit www.breathid.com online or call toll-free 1-888-EXCELLENS.
Now let's talk about esophagus cancer. It's 2 times more common in men. It's the 6th cause of death by cancer. It's fatal when diagnosed. Is a very aggressive cancer. It has a more incidence in African Americans in this country. There is no symptoms, and that's also a cause of the survival. The survival in 5 years is 10% in Europe. In the United States, 20%. There were 456,000 cases in 2012, and is the 8th more common cancer in the world. So esophagus is the canal or the tube that brings food from the mouth to the stomach. There are 2 types of cancers: squamous cell carcinoma, is more common, and then is more common in Asia and Africa, and then adenocarcinoma. The squamous cell carcinoma is in the upper part of the esophagus, close to the mouth, and the adenocarcinoma is in the lower part of the esophagus, more common in the United States and Europe. The adenocarcinoma has increased dramatically because the cancer is related to increase of the size of the abdomen. So it is related to obesity and is related to the pressure of the abdominal towards the upper cavity, where the juices in the stomach might affect the lower part of the esophagus, increasing the risk. Then is what we call by esophagitis with reflux, or with what we call Barrett esophagus. This is a more cause of the lower part of the cancer, related to GERD, or gastroesophageal reflux disease, and that's common in overweight people. So is also the upper part of the stomach, and then is related to what happens when a person drinks or smoke. And I mentioned about HPV because of oral sex, so is more common in this part of the stomach. HPV is related to 12 to 39% of upper cancer, so it's relatively frequent to have this cancer related to this virus. I am from south of Brazil, in the Gaucho country of the South Americans, and then we had a tradition there that we call mate. Mate is for you, and we call mate or machi. Machi is a herbal beverage common among the Gauchos. They use a metal straw which keep the tea extremely hot, burning the esophagus constantly. And as you know, stomach cancer is endogenous of this area, of the same area that use the machi. And I remember I have a friend whose father got esophagus cancer just because he was a machi user, and he burned his esophagus constantly with that. So the metal is very hot, but it's not just the temperature, as I will mention you later. Those are pictures of gauchos drinking mate, including children. What I would not advise, as mate is rich in caffeine also. And caffeine is not a good idea to give to kids at young ages. Well, I don't eat or I don't drink any type of caffeine, so I don't advise caffeine, even coffee. So maybe I'm biased against that. You might say, well, you are now drinking tea. Well, this was just for the sake of a picture, as I have those things as a tradition. I mean, if you go with my cuya is where they put mate. This cuya is empty. Mate was produced by a tree called Ilex paraguayensis. The Ilex paraguayensis is the tree that they take the leaves and they put the leaves in a furnace, and then to dry those leaves, and then they drink with when the trees are dry, they kind of grind them, and then the mate is ready, and then they put hot water, and then they suck with that metal straw. I was mentioning that is it only the temperature that can be a factor for cancer. And then I read this article by Kamangar et al. In 2008. And then he found high levels of carcinogenic polycyclic aromatic carbons, or PAH, in mate drinks. Well, this PAH is the same that is found in cigarette smoking. And then they found in the leaves. And I remember when I was a kid, my grandfather, he used to have a small house where they used to put mate leaves, and then and they put fire under that, and these leaves will be dried, but dried because of fire. And in the process of this smoking produced by the fire, that's where we have the polycyclic aromatic hydrocarbons, or PAH, that are increased, put a person at increased risk of cancer. When looking at the leaves of the 8 commercial yerba mate products, in Brazil we call erva mate. Yerba mate is a version of a Spanish version of that, yerba mate, and we call erva mate. The researchers found that the same research that I mentioned anteriorly, that PAH concentration ranging from 2 to 11 times the levels found in green tea leaves. Green tea also has the green tea of the mate. So is increased when you have commercial mates, probably because of the process of drying. Regarding the amount of PAH found in the drinks made from erva mate leaves, the researchers found that both hot and cold water preparations contain significant amount of PAHs. In this one, he said that if preparing the traditional way and consuming amounts typically enjoyed by the South Americans, the intake of certain carcinogenic PAH was comparable to a person who would get by smoking a pack of cigarettes per day. So if a person is smoking and drinking mate, is a prescription for cancer for sure, but only smoking separately and drinking or sucking mate isolated would have a risk of this cancer increased. The study authors noted that the comparison with cigarette smoking is supported by other research that shows that urine levels of breakdown products of PAH are similar after smoking cigarettes and drinking mate. So I have a problem in my family now, because we are gauchos, we never drink mate. But my son married an Argentinian version of mate, an Argentinian version of a gaucho, that they drink mate and they say, well, mate is good for you and there is no problem with that. Of course, I don't agree with that, and I hope at least my grandkids will not drink mate. If we go to Asia now, from South America we move to Asia, we will have there a seed or a kind of nut that they call betel quid, that also is related to esophagus cancer. Chewing this palm fruit, or they call betel quid or betel nut, can cause cancer of the mouth and the esophagus. Many times the betel fruit is prepared with tobacco. Again, we mentioned about drinking the mate with smoking increase the risk. If the person chew this mix of betel quid with tobacco, so the increase in risk of esophagus cancer is much bigger. So I went to a place one time, and we see when I went to Taiwan, and in Taiwan, when you drive in the roads, you have those ladies that are preparing with the betel nuts, mixing with tobacco smoking, and prepare the paste that they sell for people to chew. And you see those. We see those stations, I mean, every 2 or 3 miles in roads, and they are selling. I took this picture by myself and was an old lady. Most of them are very young lady, and they dress very attractive to attract the drivers, and the drivers are attracted to the girls and also attracted to the betel nut. So what are the limited evidence that fruits and vegetables can protect against this cancer? Exercise also can protect it, not very sure, and processed meats increase the risk of this cancer. So now let's talk about mouth, larynx, and pharynx cancer. Alcohol is a cause of this cancer. Tobacco causes 60% of the cancer of the larynx. The gastric reflux also increases the risk of larynx. Larynx is the cancer of the voice that we have. Is larynx that produces the voice. Betel quid also is a cause of this cancer. MATI also is a cause. The presence of HPV for oral sex also is a cause of cancer in these 3 areas, and fruits and vegetables offer some protection to these cancers. And I would mention as an example here Tony Gwynn. Tony Gwynn was a famous baseball player. He used to chew tobacco, and he attributed his death on July 16 of 2014 due to chewing tobacco because of he got oral cancer. He was a Hall of Famer player who spent his entire career with the Padres. They even call him Mr. Padre from San Diego. And then he was a very talented person. And he had 2 operations for cancer in his right cheek. And then between 2010 and 2012, the second surgery was complicated, and they have to remove a facial nerve because it was intertwined with a tumor inside of his right cheek. They grafted a nerve from Gwynn's neck to help him regain facial movement again. Otherwise, he will be paralyzed and will be hard to chew. But this is the consequence of chewing tobacco as a cause of oral cancer. And we have other players, basketball players, that are used to chew tobacco. And then Baby Ruth died from nasopharyngeal cancer. And then Kurt Flood had throat cancer. And then Brett Butler had throat cancer. Brett Butler was still alive when we recorded this in 2017, but he had a big fight with the cancer due to chewing tobacco. Nasopharyngeal cancer. This is a cancer common in Hong Kong or in Southeast Asia. It's related to smoking in 90% of the cases. Alcohol in 75 to 80% of the cases. Someone mentioned about vitamin A deficiency, not proved, is related to the presence of a virus we call EB virus or Epstein-Barr virus. Is related to the smoked meats or salted meats, and especially salted fish. And also in some industrial environments to the exposure of formaldehyde. Nasopharyngeal cancer is considered the Cantonese cancer, common in Guangdong province in Hong Kong, all of these provinces surrounding Hong Kong is the Guangdong province, and where people speak the Cantonese language. By the way, very difficult language to speak. I tried to learn that language, and it has 9 different tunes. So they speak a little bit different in the tonality, and people cannot understand anymore or have a different meaning. It's true, the nasopharyngeal cancer in this part is more common in men, twice. Is related to Epstein-Barr virus since the infancy. Is necessary to have Epstein-Barr virus, but is not sufficient, meaning that many people might have EB virus, but just EB virus will not cause the cancer. But if they have EB virus, more smoked meats, fish, then they can have the recipe for the cancer. And also there is a relationship of the CYP enzyme that are the phase 2 enzymes that produce cancer. I took a picture in the Hong Kong market with shark meat or shark skin smoked meat, and so they sell in the street. In the side you have a lot of other dry fish that they sell. I don't know if people will eat that shark, but I found it interesting that they have the skin, and I had to take a picture. I mean, this is the closest that I will get to a shark. Let's move to kidney cancer. Still related to esophagus cancer, still related to nasopharyngeal cancer. I had 2 patients in Hong Kong with nasopharyngeal cancer. One was a man, and then he did all the treatments, and then he came to me to look for a diet. We prescribed a vegetarian diet. We sent him to a center in Malaysia that was promoting a treatment with a vegetarian diet. He was doing well, but then he felt very weak, and he was craving for meat, and he started eating meat and smoked meats, and then the cancer came, and he died in a few months. The second case was a lady that has nasopharyngeal cancer, also came to me for advice, and I put her in the vegetarian diet, and she went to that place also in Malaysia, and she spent a lot of time changing her style of eating, and until this day in 2017 she was still alive. I'm not saying that this is the ideal treatment. We will advise when we get in the chapter 18, we will talk about the diet detox and what are the diet that we advise to prevent cancer and to treat cancers. But we believe that a vegetarian diet is the ideal one. Now let's move to kidney cancer. There are 337,860 in 2012. And this is predicted to raise to 400,000 in 2010 souls. There were more than 300,000 cases in 2012, and the prediction is to increase to 400,000 in 2020. It's a cancer that is twice as much common in men, 59% in developed countries. So it's a cancer of the United States, this country. The 5-year survival is 72% in the United States. The relationship of this cancer is with overweight. So it's a cancer related to obese people, or to being obese. Not that all obese will have, but person overweight and obese will have a higher risk. Also, if a person is overweight and smoking, smoking is related to 50% increased risk. There was a drug that was used as analgesic in the past that is called phenacetin. Phenacetin is a cause of kidney cancer, but is a drug that was taken out of circulation and nobody is using that drug anymore. If a person has a disease, polycystic disease of the kidney, also increased risk. Hypertension is a cause of this cancer, so we don't want to have hypertension. That's why it's important to control it. And the lifestyle to control hypertension is related to a vegetarian diet, eating more fruits and vegetables, exercising, controlling stress, controlling weight. In a nutshell, is a lifestyle, a healthy lifestyle that we have promoted during this program since the beginning. The kidney cancer is also related to arsenic in the water. Overweight and obesity increase the risk of 30% of risk of each 5 BMI points, and 11% increase by each 10 centimeters of waist circumference increase, and 26% increase for each 0.1 increase in waist-hip ratio. In the arsenic in the water is limited evidence, but again, it's important that people that live in the countries that have this, that they pay attention. In Bangladesh, Bengali Delta, Taiwan, mainland China, Argentina, and Chile. In the United States, there is some contamination of the water in Nevada and Arizona. Renal cell carcinoma is most common. Obesity probably an effect of insulin and leptin in renal cell carcinoma. High insulin in obese leads to hypertension, another factor for kidney cancer. Obese leads to inflammation, as we mentioned before, and then the TNF-alpha and IL-6 and leptin are cancer promoters that will increase the risk of this cancer. At least is the mechanism that we use. So again, in this cancer, adult attainment height is a strong evidence that is producing the cancer, related to growth factors, mostly related to energy foods. Increased insulin, increased pituitary-derived growth hormone, increased insulin-like growth factor. All of these accelerate the cell divisions and increase the cancer development. Alcohol is protective against this cancer. It's very interesting. I don't buy much on that, but I have to refer what the science says. Less than 30 grams per day or 2 doses of alcohol is more likely that the protection is for women and not for men. And moderate alcohol decreases insulin and risk of diabetes type 2, and also has diuretic effect. Now let's move to gallbladder cancer. Overweight and obesity increase the risk of this cancer. Obesity increases gallstones formation, and then a previous history of gallstones is also a risk. Now we have a few cancers that we don't have much evidences, and at least related to diet and exercise, like the blood cancers, lymphomas, Hodgkin lymphomas, leukemias, and we don't know much about the causes. Hodgkin lymphoma is related to EBV, the same virus that is related to esophagus cancer. HIV from AIDS and immune suppression. So it's common with people that have transplant, and then they have to use drugs to suppress the reaction of the body against that transplanted organ. And then they might have Hodgkin lymphoma later on after a couple of years. Leukemia is related to radiation, to tobacco smoking, to benzene, to human T leukemia virus. That's what we know about these blood cancers. There is an evidence very limited about the protection, probably protection by vegetables and fruit intake. Milk and dairy may increase the risk. Red meat is a cause, overweight is a cause of the cancer. But is limited evidence. Agriculture farmers, soybean plantations, cattle farms, milk production, they use a lot of herbicides, and then they have a high risk of leukemia. Workers in the industry of rubber, asbestos, and tire also are exposed to more substances that increase the risk of leukemia. Even a drug that is used to the treatment of cancer can increase the risk of leukemia. So drugs used in the treatment of breast cancer, ovary cancer, lymphomas, chemotherapy for these cancers can cause leukemia later on. This is something interesting that doctors in Rochester Medical Center, they made a research with feverfew. Feverfew is an herbal that is used for fever, and then it has partenolide. And the partenolide, it looks like it helps to destroy leukemia cells, leaving other cells in the bone marrow without effect. So they said that is something that would be used for myeloid leukemia. And lastly, we have thyroid cancer. Thyroid cancer can be caused by iodine deficiency or excess of iodine. Fish consumption seems to protect against this cancer. Vegetable consumption is protective, and overweight is a risk of cancer, and the 5-year survival is 70%. But we don't know much more about these cancers besides those factors. And this is the last slide. Yeah, though I walk through the valley of the shadow of death, I will fear no evil. For you are with me, your rod and your staff, they comfort me. So even if you are in the valley of the shadow of cancer, you should not fear no evil, because God is with you, and God will help you, heal you. For sure He will heal you. Maybe not in this life, but one day the healing process will come when Jesus comes back to this world. Thank you very much. I will see you in the next chapter of the Cancer Prevention Seminar.